Welcome to Focus on Seniors, a television show sponsored by Helping Seniors of Brevard County, Florida. The show is designed to make you aware of senior issues, needs, and resources available to help us age in place and with dignity. This show will help you as you develop your own aging and care plan. Now, here is your host, Joe Steckler.
I'm Joe Steckler, and welcome to Focus on Seniors, a television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is the Rehab team approach for rehabilitation. And with me in the studio is Debbie Wahl, who is a nursing supervisor with HealthSouth Sea Pines Rehabilitation Hospital. Welcome, Debbie.
Thank you.
And before I even start asking you questions or anything, I want to tell our audience that I'm proud of the fact that I'm 80 years old and that I've recovered and suffered some of the experiences that I've had. I've traveled all over the world in the Navy, 38 years in the military, but this is the first time in over 280 television shows I've had a guest that was born in the same town I was, is close to the same hospital, and knows the streets that I lived on. It's a small world.
It sure is.
Which points out the fact, Debbie, that no matter how old we get, no matter how senior we are, or how many experiences in life that we've had, we can always learn a little bit more. So my desire today is for you and me to talk about patient recovery. What makes it easier for a patient to recover from a fall or from a surgical procedure or from a stroke? You've been a nurse for a number of years. Has your nursing expertise been directed toward this line of work?
For the most part, yes. I've been here 22 years, so I've been in rehab for quite a while.
So I have a daughter that is an oncology nurse. Mm-hmm. I have a granddaughter studying to be a nurse. I have another granddaughter just finishing up getting her degree as a hospital administrator. I feel like that I've been blessed to have a lot of people in the family doing things that would help people. But I'm very interested in the fact that I have suffered a stroke, and I've had an aorta dissection, I've had a hip replacement, I've had a lot of things that would incapacitate many people. They would never recover from them. I have. But I've had good nursing care, good doctor care, and it's helped me. So my question to you, Debbie, as the nursing supervisor at HealthSouth Sea Pines, what do you think a rehabilitation hospital such as HealthSouth Sea Pines, what does that bring to the healthcare equation in terms of helping people get started on the right path for recovery? And how do you do that?
Well, this is an acute care rehab hospital.
Okay.
We also address medical needs as well as the rehab needs of the patients. And we do an interdisciplinary type care here. We have physicians, we have nurses, we have physical therapists, occupational therapists, speech therapists, respiratory therapist, and everyone works in an interdisciplinary approach to treat the entire patient.
It's a team approach.
Mm-hmm.
And that's what makes this different from anything else. Like if a normal person in a healthcare situation would have a primary care physician. Mm-hmm. They go to the primary care physician, and then that primary care person may refer that patient to a specialist. Mm-hmm. They have to get all the reports. But when I came to HealthSouth Sea Pines following my stroke and my initial hospital stay at Worcester, I was transferred here to HealthSouth Sea Pines, and I felt like the whole world was here. I had a doctor that listened to my description of my pain when I heard how I felt. You visited me. I had other nurses that administered my medicines. I could ask a question and I could get an answer. I didn't have to seek that answer. The answer was here for me. So as I entered my therapy, I did so with a sense of less worry. I didn't have things that I didn't have a lot of unknowns, and I felt very comfortable here. And so, as a nursing supervisor, how do you feel about your job in trying to help a patient relax and become involved and motivated in entering into their care?
Well, each patient, based on what the physician evaluates and the therapists evaluate and nursing evaluates, each patient is treated as an individual.
Okay.
Each patient has an individual plan of care, and we try to take into consideration all factors making that plan of care so that we can try to help that patient through what they need to be helped through.
How often do you evaluate the patients?
Well, patients are evaluated on a daily basis by everybody. If a patient's not progressing as well as they should, or if they're progressing faster, everybody's evaluating constantly the patient's progress. Now, formally, we have a meeting once a week with the physician, the nurses, the therapists that are working with the patient, the case managers, and everybody reports in that meeting what the patient's progress is so that everybody's kind of on the same page, on the same level with helping the patient achieve their goals.
And I think that makes a difference in what the outcome will be.
Mm-hmm.
I know in my own case, your speech therapist didn't think that I needed a speech therapy. And I agreed with her, but what that meant was I got another hour of physical therapy. So I went from 2 hours of physical therapy, because occupational therapy is really, it's also physical therapy.
Yeah, all the patients that come have a minimum of 3 hours of therapy a day.
Yes.
So, and that's usually divided between speech, occupational, and physical therapy. But like you said, if you don't need the speech therapy, then your 3 hours is divided among the other 2 therapies, so you get more that way.
But I think it's more than that. I think you've got the 3 hours in regimented therapy type things, but in between you've got the nurses evaluating you as how well you've become in transferring from a bed to a wheelchair, or how well you ambulate getting to a shower, mm-hmm. or what have you learned, or how well have you learned something in occupational therapy. If you're here, you're under a constant period of observation.
Yes. Yeah.
Yeah. And what is generally the length of time a person will stay in a rehabilitation hospital?
It varies person to person. And, it always depends on how bad the stroke was, how fast you progress, if you have any complications along the way, but generally, usually about 2 to 3 weeks.
What is do you have patients that actually, they cannot progress and they cannot stay, or how does that happen?
Occasionally that does happen. We do our best to try to get the patients up and out and back where they want to be, where they were previously. But occasionally, there's some people who are just so impaired by the stroke, or they have so many other medical complications and things just don't go well for them. So sometimes, our patients do go to a skilled nursing facility in the end, but not the majority of them.
People watching this show will look at the title and they'll say, what are they going to talk about? I think that we could talk about what happens in the hospital setting, mm-hmm. but I think as the director of nursing in the hospital, you are very much aware of things that people could do in living their lives before they even get into a hospital situation. Mm-hmm. I'm talking about nutrition,
blood pressure control.
blood pressure control, control of things like diabetes, proper use of medication. How, as a nursing supervisor, what kind of advice could you give to a viewing audience about what are some of the things that they can do before they even get to a situation where they have a stroke or where they fall? What are some of the smart things that we can do back down the line to make aging easier on people? That's a loaded question.
That's a big question.
Yeah.
Well, as usual, diet and exercise always comes up. It makes a difference. You know, if you watch your cholesterol, watch your blood pressure, watch your numbers, follow your doctor's instructions, take your medicines like you're supposed to, like you said. If you have any kind of symptoms at all that you think could be a stroke, it's very important to get to the hospital quickly, because time is of the essence with this. Anything like slurred speech, double vision, weakness on one side, numbness, nausea and vomiting if you don't think you've got anything viral. But it's very important to get help as fast as you can, because in some cases with some strokes, medications can be given to alleviate, sometimes reverse the symptoms.
That's I've gotten into that topic with a couple of doctors and a couple of nurses, and since you you deal with it more here at HealthSouth Seapines, I'd like for you to explain to our viewers what we mean by this 3-hour window, and what sometimes the medications can be used to effectively slow down the onset of a stroke. In some cases it can't. Can you explain what these different types of strokes are and what the medications do?
Well, strokes are primarily 3 different types. There's a hemorrhagic stroke, where you have a vessel that literally bursts and bleeds into the brain. You have embolic strokes, where there is a clot formed somewhere in the body. A lot of times it'll be in a heart with a patient with atrial fib, and that clot may travel to the brain. Or there can also be a third type of stroke where a clot just forms for some reason. And when an area of the brain is blocked off, it doesn't get oxygen, it doesn't get nutrients, and basically that area of the brain is affected, and whatever body part that part of the brain operates is also affected.
Okay.
And with a hemorrhagic stroke, which is the most serious kind and has the highest mortality, the medications, they can't give them to you. But with the other 2 types, that are the clot-forming types of strokes, there are medications that they can give that can alleviate that clot situation and restore the circulation to the brain.
Okay. In my case, I think that I had the hemorrhagic, which was they bleed out outside the brain.
Yeah.
So my situation was complicated by the fact that I was on blood thinners.
Yeah.
And I had about everything working against me that it could possibly be
Absolutely.
worked against me.
Yeah.
They couldn't operate because
Right.
I would have probably
Bleeding.
bled
Yeah.
out on
Yeah.
the table. So somebody more powerful
very
than me.
lucky. You're
Yeah. But
very lucky.
I like to think that, you said I was lucky. Yeah, I was. But when I awakened in the ICU and I felt the tube stuck down my throat, after having lived through a dissecting, ascending and descending aorta, I lived through that. Most people don't. Now I have the stroke. What am I supposed to do? What am I supposed to, how do I live the rest of my life? And what do I use to make information available to people so that they can lessen the chances of happening to them what's happened to me? And that's why I resolved to do this show. And this is why I want people like you talking to the viewers so that you can see firsthand, viewer, what a nurse that copes with this kind of thing, what really happens. And there are a lot of things that you can do. I remember that you stood at the foot of my bed and I said, nurse, I said, and I think Dr. LeBron was with you. And I said, as a doctor and a nurse, what are some of the things that if you were on this television show, what would you tell people about weight control? And I didn't say it that way. I said, Debbie, what is one of the biggest factors that you have to cope with in people as they recover from strokes and from broken hips? And what did you say? Do you remember?
Yeah, being obese.
Yeah.
Yeah. Yeah, it makes it tough. It makes it tough to recover from anything.
But explain to our viewer, not only is being overweight why it's important, how that impacts other physical elements in your body. It makes it harder for you to cope with things like stroke and operations.
Well, when you have a stroke, you've usually got, if the stroke's bad enough, you've usually got weakness in your arm, weakness in your leg on one side of your body. And when you come to rehab, you have to try to learn how to maneuver your body around with those weaknesses. So the more weight you have, the more difficult that is, just to be able to move your body for rehab.
And I've asked many doctors about this, and when you start talking about the subject of people overeating, it can be a very touchy subject, as you know and I know. Mm-hmm. A lot of people don't want to know about it. They don't want to talk about it. Every night, I could eat a dish of real ice cream. Mm-hmm. I love ice cream. I could eat it anytime. Mm-hmm. But I know what it does to this. And I can't do it. I have found that the other night I was sitting at home and I told my wife, I said, do you have any of those brownies left you had for Christmas? And she said, yes. So she said, got me some of those brownies. And I ate those brownies. And I think I had what I call a sugar rush. Mm-hmm. And I didn't know if I was going to live or die.
Yeah.
It scared the thunder out of me.
When you're not used to eating it, and then you do, yeah.
Yeah, but it's the things we do to our bodies with what we eat and the way we treat ourselves, or we put ourselves in a stressful situation. Mm-hmm. A lot of people have said, Joe, you're dumb to do these television shows, to do this. But this is my life. I feel like that God has given me a talent for using what I've learned over the years. Mm-hmm. And if I can help people understand that they might be making a mistake in how they're living their life, or there's something they can do better, then we need to get it out. And the subject of information and education is so important. As a nurse, I know my own daughter, that if I asked her a question, when I told her that I was going through they found an infection in my back, mm-hmm. and they put me on a very, very strong antibiotic medication. They put it through I think it's a pick they put in your arm and it goes into your heart where the medication, and I had to go through a infusion treatment for 6 weeks. And it was a very strong medication. And my daughter picked up on that right away. Well, it turned out it was a medication I shouldn't have been on, and they had to change it. But our body sends us signals. And
absolutely. Yeah.
The smarter we are about listening to the signals our body sends us, the better off we're going to be. And we can't always depend on a doctor or an Affordable Health Care Act. We get sent simple signals all the time. Mm-hmm.
You need to know your body.
What's that?
I said you need to know your body.
You need to know your body.
Mm-hmm.
Yes, you do. Here at HealthSouth Sea Pines, medication is an important part of a stroke victim's recovery. I know that Dr. LeBron and Dr. Kearney, when they would come in to see me, would ask me questions about how I was feeling, or did this medication, did it lessen the pain? But I noticed they were asking me key questions that I could see that there might be an interaction with other medications. And I think that is, Dr. LeBron he's a special kind of a doctor. I can't remember his title exactly.
He's a physiatrist.
He's a what?
Physiatrist.
What is that?
That's a specialist in rehabilitation medicine.
Specialist in rehabilitation medicine. I'll ask him when I get him on the show, but does he deal with the different types of medications? Is that part of it?
Mm-hmm. Yeah.
Everything I'm saying is selling HealthSouth Nebines as a rehab, but it's important.
Yeah.
Our whole show, our whole organization, Helping Seniors of Brevard County, Debbie, is about information and education. If people are not educated, if they don't have access to information, they don't know some of the things they can do and they can't do. You have a manual called the WITH Manual, and it stands for Wellness Information and Tools for Health. Mm-hmm. And I did that. I pulled some things out of there to talk to you about. And one of the questions I wrote down was the importance of medication monitoring. Mm-hmm. In a stroke victim's recovery, how important is medication and the way it's administered and the effects of that on the body? Because there are so many things that the doctor has to be concerned about with a stroke.
Mm-hmm. Well, usually stroke patients are on several different types of medications. Frequently, they've had a history of high blood pressure, diabetes, all those things we've talked about that plays into strokes. Those all have to be balanced out. When you are in the hospital and you're sick, your body changes. So you may need more of some medications or less of some medications. New medications that they start you on may interact with some of the old ones you've been on. So those all have to be monitored.
I think that's a thing that I think most people don't think about when you suffer an illness that you are confined to a hospital, that there are so many medicines. The primary thing that doctor has to be concerned about is your recovery from the situation that put you in there in the first place. So therefore they use the medications designed to help treat the immediate situation.
Right.
Does that situation, do you often find a conflict of medications?
Oh, sure. Yeah. Yeah.
How important is that, or how does a patient cope, the body cope with these different administrations of medication?
Well, whatever medications the patient was on previously to coming to the hospital, all of those are reviewed by our physicians. And then, of course, medications can be changed while you're in the hospital. And then all the medications are also reviewed again before you leave to make sure that you're on what you should be on at the time for what you're going through.
So, from the time you leave the hospital, that's one of the first things I did was I saw my cardiologist and I saw my primary care doctor. And the cardiologist was the one that said, no, you can't do this. Yes, you can do that. And with the fact that I'd had to bleed out, and at the time I was on a blood thinner, right. And I also have atrial fibrillation, all things which are risk factors for stroke,
right.
They had to adjust my medications so that they could lessen the impact of one thing on another.
Mm-hmm. And hopefully not cause it to happen again.
It's what?
And hopefully not have it happen again.
Yes.
Yeah.
That was the question I had for Dr. LeBron. I said, now that I have had a stroke, what are the chances of me having another stroke? And I think what I got from his answer was that if I had a severe headache, get to the hospital as quickly as I could, the emergency room. Mm-hmm. That would be my first indication that I might have another stroke onset.
That's often the first sign you get with a hemorrhagic stroke. It'll be the worst headache you've ever had in your life, really quick.
It comes on real quick?
Mm-hmm. Well, if you think about a vessel bursts right then.
Okay, so it would be a blood vessel burst that would cause the headache. See, I didn't realize that. So by having you on the show,
the blood irritation and the pressure in your head is what will cause the headache so fast.
you reaffirm everything I talk about on every television show. I say that there is no substitute for information. You can never find out enough. But also, you have to pay attention to what your body tells you. And you said that earlier. As a supervising nurse here at HealthSouth Rehab, what kind of advice would you offer to viewers on how to lessen their risk stroke? What can people do to lessen their chances of having a stroke? What should they pay attention to?
Well, first I would say you should know your family history. If there's been a lot of strokes in your family, your parents or your grandparents, so you're kind of aware that it does, run in your family. I would say definitely get checkups with your doctor, monitor your blood pressure, your cholesterol numbers and things like we discussed earlier. Know your numbers, that's what they say. If you do have any kind of symptoms, like we've discussed, get to the emergency room right away. I would call 911. I wouldn't try to drive there.
That's a good point.
Yeah. And just generally try to live, a better lifestyle, exercise, diet, not smoking, not drinking to excess, all of those things in accumulation.
Okay. And the one thing that, if all this does happen to you, if you try to do the very best you can not to have any of these, to lessen the risk factors, it still happens. There is a key word that came out to me in my first talk with the people there at HealthSouth, and that was the word motivation. If the patient is not motivated to help themselves recover, the chances of recovery are greatly reduced.
Absolutely.
So what?
The patient has to be motivated, and the other really big factor that we see is support system. Family involvement, neighbors, friends, church friends, makes a big difference.
It does, and I found out with visitors, they can tire you, but it makes a lot of difference when you see people care, and people do care, and sometimes we forget that.
It helps to keep you engaged.
Okay.
And working towards your own recovery.
All right. I want to thank you, Debbie, for being with me today here. And it was I thoroughly enjoyed having you on this, and I think you're going to enjoy watching what we talked about. But I want to thank you, viewer, for watching today's episode of Focus on Seniors. If you have questions or comments, please call 321-473-7770. For more information on senior care and resources, visit our website at helpingseniorsofbrevard.com. Be sure to listen to Focus on Seniors on radio station AM 1300 WMEL every Thursday morning at 9 a.m. And look for us in Florida Today newspaper every Thursday for our Focus on Senior column. I'm Joe Steckler, and thank you for joining us today for Focus on Seniors. Thank you, Debra.